This is a mixture. This is a mixture of erythroplakia and leukoplakia. Erythroleukoplakia, a mixture between erythro or leukoplakia. Sometimes they call it speckled leukoplakia, يعني مرقطة. It shows dysplasia, this bad plasia growth. If you want to take a biopsy from this lesion, you take it mostly from the red area. It gives more يعني يعني the better diagnosis is when taking it from the red, because the red is more suspicious than the white. In some cases, this is chronic candidiosis. It could be. This could be appearance, ill-fitting denture, or patient old. The patient has systemic disorders, مثلا uncontrolled diabetes, uncontrolled hypertension, and immunosuppressive something. So it could be a candidal infection. It could be a pre-malignant lesion. The best diagnosis is by biopsy. But from this clinical picture, you can see the patient is an old patient, نوعا ما bad oral hygiene, so it's suspicious. Slide number 7. This is leukoplakia. This is a white lesion. This is questionable. It could be a bad disease. It could be something related to malignancy. As you can see, it is homogeneous, تقريبا متساوي, flat. Sometimes if we ask the patient انه مرات عندنا ابو كيسات انه يخلون شغلات يسموها unsmoked tobacco اللي هذا التتن يخلونه بهاي المكانات احتمال. This is all irritate things that could cause this lesion to be a potentially malignant disorder. It's suspicious. It should be biopsied. خاص especially إنه we don't have another cause. يعني هذه ما location مال denture حتى نقول ill-fitted denture وكذا. We should take biopsy to confirm the diagnosis. Slide number 8. This is also a clinical feature of a white lesion, not only white and red a little bit. As you can see, we have a patient bad oral hygiene. It could be candidiosis, but biopsy showed that biopsy will confirm the diagnosis. Patient is old. This is the first picture or image. The second picture, it's an innocent looking, poorly defined white patch on the lateral border of the tongue. After biopsy, it showed that it was a malignant lesion several months later. يعني بهالحالة don't look at the lesion and know it's small or white, or all of it should be suspicious. Especially we have the lateral border of the tongue, the ventral surface of the tongue more suspicious, and the floor of the mouth. هاي المكانات the retromolar area. These are all suspicious locations that should be considered or biopsied if you cannot give a diagnosis. Slide number 9. Pathology of leukoplakia. We said it's white because we have hyperkeratinization and we have moisture. 85% show dysplasia. هذه قلنا الإحصائيات هي ما تابعة لبلدنا، تابعة لليونايتد كينجدوم. From these dysplasias, 80% show mild, 5% show moderate, and 2% are severe. نرجع بعدين راح نحكي على الأورال epithelial dysplasia. We have another term باللeukoplakia, it's called sublingual keratosis. This is another cause of white lesion. This involves the entire ventral tongue and floor of the mouth. It's wrinkled, no red appearance, but it can indicate a high risk of transformation to malignancy. So you should take in consideration. ومرة ذكرته إنه طالبة عندنا كانت المرحلة الرابعة آه، قد تعمل بالأوبراتيف كيشي and she saw this lesion. رأسا خبرت المعيدة الجونيور. هي والمعيدة نزلوا جماعة surgery. They took a biopsy and it turned out to be a malignancy, and the patient, this diagnosis, early diagnosis, was life-saving for the patient, and the patient came for an operative procedure filling, and this by chance this lesion was discovered. So it's nice to look all around the oral cavity. You might discover something that the patient had not discovered. Slide number 11. Another type of white lesion is called verrucous leukoplakia. It's also common. We can see these types of lesions. They are suspicious. They should be taken in consideration. Biopsy is very important to exclude any potentially or pre-malignant lesion. We have other types of white lesions, and we have lichen planus or lichen planus. We have many types of pre-malignant lesions. صراحة الوقت هو ما كان يسعفنا إنه نبدي ندخل داخل, but we have a lot of potentially malignant lesions. Some related to lichen planus اللي هو autoimmune disease. It could be related to candidal infection, fungal infection, and so on. We should take all of them in consideration. And this lecture ended, and thank you for your attendance.